the obliquous inferiors seem to be, it's a weak, vulnerable joint, a big, heavy mass on top of a little structure there with just these tiny little muscles on either side turning the head. It's a vulnerable spot for a lot of stress to collect, and so the guarding up here can be up to 100%, meaning that the cerebellum is like, you turned it up to 11. It's not going to relax. It's going to pull as hard as it can and never let go an inch. A person who's guarding on both sides as hard as possible with both obliquous and inferior will have only 45 degrees of motion either way. And that motion isn't happening at the atlantoaxial joint. There's no motion at the atlantoaxial joint for most people. The rest of the motion is happening in between C2 and 3, 3 and 4, 4 and 5, 5 and 6, 6 and 7, and 7 in the first thoracic. As those facet joints, like the rest of your spine, are turning, those same facet joints are turning, and that allows the addition of 7 and 8 degrees in each joint adds up to about 45. And none of the 45 degrees of atlantoaxial joint is coming in if both are in spasm. If one is in spasm, that's even worse. And once you get some guarding in one obliquous, then the muscles, the other rotating muscles, the Sterno-Cleido-Mastoid, which can pull this ear forward and down. See it popping out there? It goes from here to here, basically. So when it contracts, it pulls this closer to this. What happens when one obliquous is really super contracted? When one obliquous has contracted into spasm, normally that would pull your head like this and you'd be walking around like this. But the visual parts of your brain don't want you to be, hi there, I'm Patrick, and it wants your head to face forward so that your vision, so that you can locate with equal distance from either eye and go, oh, you're that far away, okay. That's very important to the visual parts of the mind. Maybe a blind person would walk around like this if their obliquous was in spasm, but a person with eyes open is going to correct their head and turn it this way. So how do they do that if it's spasm on this side? They can do that with the motion of the rest of the joints of the neck, and it actually pulls the spinous process of C2 over this way when this one is guarded. And so up the spine is coming up in a straight line, and then it veers over that way to the right when the right obliquous is spasming. And specialists in this field, let's say, when they want to find if this is happening, they before they'll actually treat you, they want to document it, and so they have you take an X-ray and open your mouth, and they focus that X-ray so it's shooting right through your mouth. And when you're shooting through the mouth, you would be seeing the atlas and axis, and you can see the spinous process of that axis is actually over to the right of where it ought to be, because my right obliquous is pulling the back of it over. So let's say that a person is having a bad day and they're looking to the right, and something traumatic happens and they're like, oh my goodness, or they can't afford to stick their neck out, or some symbolic reason to guard. And this is a very vulnerable joint. As you see it really flops around at that one joint. And so if the person's feeling vulnerable, they will often tighten up. Like if both muscles are tight, then it's more of a jerky motion like this. I'm pulling both strings at the same time now. So it gets harder and harder to move. And if the right one is pulling harder than the left one, and they're in a tug of war, it gets harder and harder to move. But let's say that the right one goes into spasm, and it won't allow any movement at all. It goes into its shortest position, And then no matter what anybody says, it's like, nope, I'm not moving. And this is more common than you think. This happens to a lot of people. So I'm just tying a knot in this to represent the shortened position for the purpose of our demonstration here. Okay. Yeah, so this person is now rotated to the right, and of course your brain's not going to let you just be rotating to the right. Your eyesight wants to have your head looking forward. There are some people who are so spasmed that they come into your office and they are turned to the right. I've never seen them, but like the textbooks talk about people like this. More frequently, you'll have the brain wants to rotate the head back to the right, and it has ways of doing that. We're going to change this muscle. It used to be the Splenius Capitis going from the mastoid process back to C7, but now we're going to have it go around the front of the neck. It's changing into the Sterno-Cleido-Mastoid on the front, which attaches to the mastoid process and goes forward at an angle, and you see it coming out down here. And we got the Splenius Capitis, we got the left Splenius Capitis and the right Sterno-Cleido-Mastoid. And I've made them as thicker strings, more like ropes here, because in fact they do have a lot more power and thickness, more horsepower than the obliquous does. And if the head wants to, if the brain wants to rotate back to neutral, it will do so. So I'm pulling both of these strings, and look, the head is coming back to neutral, but at what expense? There, the head's back to neutral. But do you see how that, now I got to hold these tight, otherwise it'll spring back. So there's several, I can see three or more potential sources of pain now. The person's looking straight ahead, so their vision is correct again. But everything's real tight here, like I can't move anything in any direction. The obliquous over here is going to be ding, ding. It's going to be like a guitar string. The one over here is not going to be doing so good. And look at how far the spinous process of C2 has come over. We used to have a straight line with the spine here. Here's the back of the head right here. And C2 is off at quite a distance from the back of the head. A therapist feeling along the back of the neck will be able to feel that the spinous process of C2 has come over to the person's right, because that right obliquous is contracting more than it should. It's more than its natural amount, and staying in spasm. It won't let go. Then also we have the Splenius Capitis on this side, this tink, 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 and the tink, 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 the Sterno-Cleido-Mastoid up here. All these muscles are going to be very tight. And not to mention that you can't really see, but the blood vessels that come up here through the side of the transverse processes have to go at a very strong kink when C2 is rotated off of its normal angle there on both sides. So you're going to be getting less blood up to the head. It also creates an unfavorable on the front of the spine. It's no longer a flat surface, so the cranial nerves that come down from the brain and supply the rest of the guts and digestion and all that stuff are going to have that rough surface they're going over in the front of the neck and maybe impinged, so the person's not going to get as much sensation coming up from their guts, and they're also not going to get as much innervation going down there, so maybe their digestion stops or other things down south stop working. Okay, so that's a very bad situation. If the person's spinous process is over this far, we want to get it back over. So what do? We have to find a way to get that little obliquous to relax. Ah. Oh. Ah. That spinous process comes back over of its own accord. You don't have to push it back over. As soon as the muscle relaxes, it just comes over all by itself. And all of the rest of the muscles are naturally come out of their tense position, and everything moves again.